Hi,
Hi.
welcome to the Sustainomics. I'm here with Sai Sharan, who is Regional Corporate Head of Nura. Good to have you here.
Thank you. Pleasure is mine.
So I have two short questions for
Sure.
you. How does AI-driven health screening really contribute to workforce well-being?
Sure. So AI in health screening has significantly revolutionized the healthcare space,
Right.
especially in the space of preventive health screening, because the kind of advantage that we have with AI is that it brings in a lot of thought process of early detection,
Yeah.
and we have been able to save lives in time.
Yeah.
And especially for workforces which count about the part where time is a constraint for them.
Definitely.
Given the busy schedules that people have, I think the kind of pioneering that Fujifilm healthcare has got into India in the form of Nura has been quite significant because we complete the whole process in just about 2 hours. That is one of the significant plus points that as an employee of any organization would love to be around, apart from the technology that we have.
Yeah, and I think also the whole concept of forcing employees to go in and get that wellness check done, they'd rather take a day off and stay home than do it, right? So AI probably speeds that up a lot faster instead of spending a whole day at the hospital. Do you think that really
Actually,
works?
AI and our whole process goes hand in hand. To answer to your question about the comfort level of
Yeah.
employees, well, every guest is a VIP at our center.
Yeah.
And we, apart from having the technological advantage at Nura, being Japanese, we are very loud in terms of hospitality.
Right.
And that is what makes it so encouraging for an individual to come to the center. In just about 2 hours, you have a very guided approach. We have a very guided approach per se. We have assigned we have assigned a person to an individual
Right.
to go from one process to the other process. So it's always a assistant driven program rather than a self-help care.
Yeah.
So people feel more belonged,
Yeah.
they feel more indulged and more valued.
As opposed to that one token in a hospital when you got to wait in line and wait for your number to get called, right?
Typically, yes. Unfortunately, that is the ecosystem, and I'm sure, and I also see that there are hospitals who are stepping up their service levels as well,
Yeah.
because we kind of complement the hospitals in terms of what we find, and also enable them to become a powerful player in the market.
Yeah.
How Nura is different is all about, like I said, we give a lot of prominence towards hospitality to ensure that every guest is equally treated.
Right.
When we call guest, we don't
Yeah,
call them
I was just going to
patients.
say guest as
We
well.
don't
right?
call them patients, we
Yeah.
call them guest, which means they are Atiti Devo Bhava when
Yeah.
they come to a center.
Yeah.
And with utmost love and respect, they are being taken care of while they're doing the health screening, which is one of the biggest plus points that we have.
Perfect. What innovations do you think are shaping the future of preventive health and corporate well-being, really?
I think there has been significant innovations, especially in the kind of test that we do, the key test that we call. Now, before earlier, there used to be certain limited means to find out heart attack, the risk of heart
Yeah.
attack. Now, we have advanced way of determining the risk of heart attack with basic and non-invasive scans. So this has become the key and has produced immense results not only for the guests who come to our center but for us as well. So some of the tests like heart calcium score, visceral fat analysis, which basically tells you
Yeah.
about your internal fat,
Yeah.
which
That's
many
a-
people think it is a sign of prosperity. That's
Yeah.
not.
Yeah.
So visceral fat is very vicious in nature. With the help of our technology, we help them understand how this can be curbed and brought into a moderation limit. And the third thing is about the bone mineral density. Now, again,
Right.
these are some of the parameters that are very key and relevant to the context of Indian medical market.
And especially women, I'm sure, because I don't think women in general, whether you're on the workforce or not, essentially care enough to do that health checkup or check bone mineral density. So when you say that, I'm sure that really...
Women per se, it's a mindset.
Yeah.
What I have learned is they first push the male.
Yeah, you'd
They,
rather look
they,
after everyone
they,
else. Than
they
yourself,
basically push their male
Yeah.
companion or their parents or brother and so on. Well, on the contrary, they don't take care of themselves.
Yeah.
It is equally important for women, the powerhouse of the house, to take good care of their health.
Yeah.
Because in facilities where hygiene is given top priority, they must visit and do the health screening, because that is what we have imbibed in our system, in our program, to ensure that every woman, because we do certain tests which may not be comfortably done outside.
Right.
So that minutest details of care has been extended to them when they visit at Nura, to ensure that they can comfortably complete the screening. And key tests such as colposcopy for cervical cancer,
Yeah.
mammogram for breast cancer. Right, this is quite vital, and it is the number 3 killer for women
Yep.
in India, and which is why they need to step up and understand why screening is important. I know symptoms are not there, but it doesn't mean there's no threat.
Right.
You drive
That's
a
true.
car with the seatbelt,
Yeah.
not without it, right?
Yeah.
So it is a mandate.
Right.
Yeah, that's the ecosystem Japan follows as well.
Yeah.
It is part of their, the whole ecosystem, where it is a mandatory for every citizen of Japan to undergo screening. If not, they're not allowed to work.
And I think it'll do well
Yeah.
for India to start following that as well.
They will. They
Yeah,
will.
which
They
we
will.
will,
If
yeah.
they see a benefit of the value in what we're
Yeah.
doing, I'm sure they'll be able to do it.
Yes, definitely. Thank
Yeah.
you so much for
Thank
your
you.
time. It's
Thank
been
you.
lovely talking to you.
Thank you. Pleasure.
Thank you.
Thank you.